Welcome back to the morning show here on Arise News. Nigeria has been fighting the war against COVID-19 for more than 6 months. Government, private sector players, and the Central Bank of Nigeria are among a long list of persons and institutions Arise News has described as heroes for their efforts during the ongoing battle. And also this day newspaper did a special stories on the heroes in that regard. But for a walk down memory lane, Arise correspondent Adefemi Akinsanya reports. Let's take a look.
Against COVID-19 is a war being fought on many fronts. The virus first made landfall on February 27th when an Italian national arrived in Lagos via a Turkish Airlines flight. Within 3 days, Patient Zero had unknowingly brought people in 2 states to the forefront of the infamous marvel that was COVID-19. Lagos and Ogun states collaborated to bring the index case and any relevant contacts into isolation in Yaba. But by then, the virus had started spreading beyond the safety nets put in place. Enter the central government. Nigeria's federal leadership underscored the importance of unity during the pandemic from the outset. Nigeria's health ministry and the Nigerian Center for Disease Control have kept the public abreast of updates during their almost daily presidential task force briefings. Aviation Minister Hadi Sirika made arguably one of the most crucial decisions to keep Nigeria's infection numbers relatively low. Closing international airspace rendered thousands in and out of Nigeria stranded. The decision wasn't popular, but many believe it has served its purpose. At the state level, despite expectations of governors to protect their populations from the deadly virus, the level of adherence to safety measures has varied. While some governors were unwavering in the rolling out of federal and state-sponsored food palliatives, others claimed their states were free of positive cases of COVID-19. President Muhammadu Buhari declared a total lockdown in Lagos, Ogun, and the Federal Capital Territory. Borders, businesses, and life as we knew it closed. Economic activity took a turn for the worse, but belief remained that life is more important than livelihood. The intervention of the private sector has been an undeniable asset to the cause. In March, when the Central Bank of Nigeria announced the formation of the Coalition Against COVID-19, a group of Nigeria's biggest banks, businesses, and high-net-worth individuals, there was skepticism. Billions of naira was pledged, earmarked for access to healthcare, testing facilities, food for millions of impoverished people, and a nationwide awareness campaign. But doubt soon turned into determination, as today, CACOVID has built several isolation centres across Nigeria, fed the population, and continues to sensitise communities on the importance of personal hygiene and physical distancing. The Central Bank of Nigeria has also created easier access to credit for industries including pharmaceuticals and manufacturing. International lockdowns meant a steep decline in the medicines, among other products, being imported into Nigeria. The CBN seeks to rebuild Nigeria's lost legacy as a manufacturing hub. And aside from CACOVID, other private sector players have made the difference. Guarantee Trust Bank sponsored a makeshift isolation centre on the grounds of the Onikan Stadium in Lagos within a week. History was made when Reddington Hospital Group's Armoured Shield facility and Zain Lab became the first private centre accredited by Lagos State's Health Commission for the testing for and treatment of COVID-19 cases. Testing was also a key part of the isolation centre donated by Chairman and Editor-in-Chief of This Day Media Group and Arise News, Nduka Obaigbena. In addition to hundreds of beds and state-of-the-art facilities, This Day Dome in Abuja also hosts 54 Gene, a genomics research, services and development company which has also been performing PCR tests for COVID-19. Despite the Great Crusade, there have been casualties. More than 1,000 people have died from COVID-19 related causes in Nigeria. Among them, President Muhammadu Buhari's Chief of Staff, Malam Abba Kyari. Career politicians, entrepreneurs, parents, siblings, men and women. Every one of those deaths a tragedy. But there have been far more survivors. Each of those lives lost, a light at the end of a tunnel the world falsely predicted would be darkest in Africa. But thanks to these heroes, in the face of pestilence stalking in the darkness, at the apex of disaster approaching Nigeria's tent, they stood up, linked arms, and formed a human shield that seeks to continue protecting Nigerians to this day. Adefemi Akinsanya, Arise News.
Well, for a chat on the heroes of COVID-19, Arise correspondent Adefemi Akinsanya now joins us. Hello, Adefemi, good morning.
Hi, Dr. Ruben, good morning.
Good to see you.
Good morning.
Yes.
Rufai.
Dr. Rufai, it's fine. Dr. Rufai, it's fine.
I tried to catch myself.
Coming soon.
Anyway, Adefemi, we took this story earlier when This Day reported it on its front page. And the question I had raised at the time is that, yes, a lot of people have done very well and they deserve to be commended. But how about the villains of COVID-19 in Nigeria? Do we have some villains or we have to wait till we have an accountability report on how the private sector and the Nigerian government both manage the crisis so far? Or are the people themselves the villains, the people who resist guidelines, who reject standard procedures?
Mm-hmm. So it's been 6 months, more than 6 months since our index case. And I think in that time we can identify tentative villains. If we look at leadership, which was a big part of this day's report and the Rise News' report, it was about highlighting people who have taken the forefront and led the populace to protect the people. And ultimately, that hasn't been the case for many people. So if you're looking at villains, for example, though it is a harsh word, you have Yahya Bello and you also have Ben Ayade. So you've got representatives of Kogi and Rivers State who for a very long time weren't as forthcoming or as collaborative when it came to introducing testing into their states. You'll all be well aware that both governors said that their states were free from COVID-19. And while on the one hand that is a good thing, something that is commendable, I think that very soon it got to a point where we had to identify whether or not enough testing was being done, how collaborative they were with the Nigerian Center of Disease Control. And that reluctance is just one part of why this day, for example, sought to describe them as villains. In addition to them not wanting to be as forthcoming with testing, there's also Kogi and how they wanted to treat their Muslim population, allowing people to go out for public prayers. You'll understand that the international lockdown or the national lockdown here in Nigeria happened during Ramadan, happened during both Eids. So you can imagine there are lots of people who were anxious not being able to go out into the streets or worship the way that they used to, but that obviously wasn't something that they could have done. If you look at Lagos, for example, it's only very recently they've started fragmentally reopening churches and religious spaces. Schools are still very much closed. We're hoping that between the 15th and the 24th of September of this month, we can see schools reopening. So you can imagine how seriously some governors have taken it and then how unseriously others have. And then if we're looking at the populace at large, it's a tricky one, because while we can say that all of these efforts are there to protect the people, if people continue, more than 6 months later, continue believing that COVID-19 is either not real or not something that they need to worry about, then ultimately there is some blame that needs to be shared out amongst all of us, because there's only so much sensitization you can do, only so much education you can put out into the streets. But I do think that as it stands now, a lot more people are aware of the risks. We have continued to say that while COVID-19 is not a death sentence, it is absolutely deadly. We have lost more than 1,000 people. So I think that when it comes to the populace, a lot more needs to be done to protect yourselves still at this point here.
Well, thank you very much, Adefemi Akinsanya, for your brilliant report and analysis, as usual.